Hello, everyone. I'd like to start by acknowledging the traditional owners of country where your meeting is occurring, but also the lands of traditional owners wherever you might be joining from remotely in this era of hybrid events. And I'm sorry I can't be with you in person, but I'm recording this for you from Wadawurrung country. And so I'd like to pay my respects to elders past, present and emerging. And I hope you're all gathered today in good health to talk about this very, very important work of the Brain Cancer Centre. So I'd like to acknowledge Professor Doug Hilton, the head of the Brain Cancer Centre and the director of WEHI, Sam McGuane, the general manager of the Brain Cancer Centre. A very special and heartfelt welcome and acknowledgement to Amy and Jason Stevenson, Lockie Stevenson's parents. In addressing the forum today, you are doing something very, very difficult, and we thank you for it, and we thank you for the work that you do in Lockie's name. It's an incredibly generous thing that you're doing. So everyone that is joining us today, of course, is acutely aware of the devastating impact brain cancer has on thousands of Australian families each year. Many of the projects focused on beating brain cancer have come from loved ones. They've been inspired by the love of a family member or a friend, and that's incredibly special. Like the hugely impactful work of Carrie's Beanies for Brain Cancer. As we've been establishing the Brain Cancer Centre, I've had the opportunity to get to know Carrie and her family's story and the generosity that she brings to this, but also the generosity that the people that she has been able to reach and contact in the community as well. Everyday Victorians supporting cancer research so that other families can have a different story. So the Brain Cancer Centre is an extraordinary culmination of these events, brings together many minds with one clear focus, and that's about making rapid progress in the diagnosis and treatment of brain cancer. Our government was really, really pleased to be able to make a $16 million investment to the work of the Brain Cancer Centre, and it's part of our continued efforts, our sustained efforts to forge new frontiers in brain cancer research. You may have noticed earlier in the week, though there was a bit going on, but I'm sure you noticed, the state budget on Tuesday of this week was all about putting patients first. It was a $12 billion investment in a healthcare system that, of course, has come under great pressure, but more nurses, more doctors, more paramedics, investments in health services, some really significant investments in health infrastructure as well as workforce. And this is all about making sure that people can have the best quality healthcare as close to them and right for their condition that they can have. And this is in addition to the $1 billion Victorian Comprehensive Cancer Centre, which is an extraordinary asset for Victoria, and our government continues to be very proud to support the VCCC in its important work. In strengthening our support for brain cancer, our shared vision is to improve outcomes for brain cancer patients, to foster and retain research talent, to attract international investment, and, of course, to fortify Victoria's position as a leader in cancer research. We're very proud of our standing on the global league table of amazing centres of excellence in medical research, but for friends, for partners, for parents, for kids, and indeed for our clinicians and researchers, we know that the Brain Cancer Centre's work isn't about accolades so much as it is about the work for individuals with a really awful diagnosis. So seeing the progress in quite short time of the Brain Cancer Centre's work, including the Brain Perioperative Clinical Trial Program, gives me great hope, because I'm confident that these projects will change the lives of children, adolescents and adults with primary brain cancers and brain metastases. We are a national leader in cancer care and research, and our decades of strategic investment in innovation and medical research has elevated Victoria's status. But of course, here in Victoria, brain cancer patients and their loved ones need to continue to receive the best treatment and care that Australia can offer. As you might know, I know from some very close personal experience that a cancer diagnosis comes with so much that is unknown. It's like staring off into the abyss, really. And if this work that you're all doing can provide some certainty, some confidence, and indeed some hope to people who are impacted by cancer, and in this case, brain cancer, then you will have all been very successful, and we'll be very proud, as we are, to have been here to support you in your work. Victoria is home to an extensive network of cancer centres, our world-class biomedical precincts and specialised manufacturers, including, of course, Australia's largest medical research institute, WEHI. We are committed to a strong and enduring partnership, and I do enjoy my frequent discussions with Doug about the future plans for WEHI, as well as the current work, an extraordinary breadth of work that's undertaken by scientists at WEHI and others in other organisations in partnership with WEHI. The work of WEHI and Carrie's Bennis for brain cancer to launch the Brain Cancer Centre has been a real investment and a real highlight of the time that I've been your Minister for Medical Research. These significant investments and partnerships across cancer research will not only deliver vital research successes, but also strengthen our reputation as a global leader and support that 30,000 people strong medical research workforce, the people that are creating extraordinary breakthroughs in treatment, in care, in pharmacology. So thank you to our brain cancer researchers for all that you do to change the lives of Australian families as they experience some of their darkest and most challenging days. Thank you especially to the families and patients who are attending the conference today. Your insights, your contributions are so, so important for informing the best possible cancer care. And again, to Amy and Jason, who will be sharing Lockie's story today. I have a deep appreciation for what you have been through, and I thank you for honouring his legacy at this forum. An incredible thing for you to do. So thank you. And finally, to our extraordinary team at the Brain Cancer Centre, I'm confident that your shared vision and commitment mean that one day, hopefully not too far from now, no lives will be lost to brain cancer. I wish you all every success for the forum, and I wish you every success in your work. Thanks.